back to the agency, and it would be their job to try and recover monies that were paid inappropriately, but didn't rise to the level of fraud. So I think that all I can say at this point is that all of those possibilities still exist, plus the fourth possibility, which is that we would just look at it and say, you know, we've looked at this, we've documented that there is no, even though it looked like a billing irregularity, that there is no, there's nothing here that would require the state to go and try and get our money back. So essentially an exoneration. So there are lots of levels there, and we sort of have to decide which bits of those evidence go and which of those don't.
Thank you, gentlemen. Mr. Chairman, well, just as a follow-up, so is there a timeline for these providers to allow them to respond to any of these issues?
Mr. Chairman, Senator, they certainly will have an opportunity to respond. If the allegations rise to the level of criminal allegations, they'll have lots of opportunity to respond to that. I think if we find that billing irregularities rise to the level of something where they're required to pay money back to the Human Services Department, for instance, I'm sure that there's a methodology where they can contest that, and so they would do that. I think, honestly, Mr. Chairman, the part that's disturbing to me, disturbing to you all, I think should be disturbing to all of us, is that under the federal rules, the implementation of these automatic check holds, once there's a finding of credible allegations of fraud, have had a very draconian effect on the providers. And that's sort of an automatic thing. I mean, that indeed is, to the best of my knowledge, all of the providers that felt like the findings of credible allegations have filed their exceptions with the agency. And there is this, I don't think that the press maybe or that you all might have picked it up so much, but once there's been a credible allegation of fraud, once there's been a check hold, the providers have the opportunity to go to the agency and file, what do they call it? A good cause, oh yes, and file a request for a good cause exception. And to the best of my knowledge, most of the providers did that, and in all of those cases that I'm aware of, except for one, the Human Services Department turned down their request for a good cause exception.
Well, thank you, Attorney General. Well, you know, there's been, just in my world, a lot of talk about, you, Mr. Chairman, General King, what you released to the media, the redacted document. And a lot of folks have contacted me about page 22, it's unredacted, that says PCG case file audit did not uncover what it would consider to be credible allegations of fraud, nor any significant concerns related to consumer safety. So can you comment on that?
Mr. Chairman, Senator, I can comment on it to the point that, like I said, we've been trying to find that balance between releasing parts of the audit that we thought did not impact our investigations. I think that I would hope that people would look at this audit the way that we do, which is as useful information, but I don't think that we have ever said that we thought that the audit in and of itself was sufficient to go to court on or whatever, and I think that that's more or less what this sentence says. The finding of credible allegations of fraud is a finding that resides solely in the Human Services Department, and so I think at some point in time it would be worthwhile to ask them what else they considered besides the audit in order to reach their conclusion that there were credible allegations of fraud. But I think that it would be, they might say that even though the auditor didn't think that this was credible allegations of fraud that they did, or they might say that they had other pieces of evidence to look at or whatever, that since we weren't privy to this committee that met in the Human Services Department that made the credible allegations of fraud finding before they sent it to us, I can't comment on it.
And of course, Mr. Chairman, Attorney General, as you mentioned, I mean, as many of us know, this has been, the reality has been 15 of our New Mexico nonprofit behavioral health care providers have been given a death sentence, really. I mean, that's what it is. And so, and I realize that's not, I mean, you're bound by your protocol and process, and you both have tried your best to do a good job here, but it's just really unnerving, just wrong on so many levels. But again, that's a sentiment we continue to share that with HSD on the Legislative Health and Human Services Committee that I serve on, as well as the Behavioral Health Subcommittee. And of course, you know, we have this back and forth where they say they have no choice, had to do this. But you yourself just mentioned North Carolina, where clearly there was a choice under these same guidelines, and they gave the providers in North Carolina the chance to at least know what the accusations were. They gave them some good cause exceptions. And so I think that's, the notion that there was no choice is wrong. But again, that's not your, I understand, like, this isn't really your realm, but it's wrong. And they had choices. They just made a choice. And they can justify their choice. But there are clear guidelines for good cause exceptions. I mean, I'm reading from a Albuquerque Journal article of September 23rd that really goes in. Deborah Baker went into a lot of detail about the choices that are very clearly spelled out. And she quotes this one expert saying the regulations are actually clear that the state is not required to suspend payment when good cause exists. And good cause exists for a number of reasons, said Adam Falcone, a behavioral health lawyer specialist. And clearly, under the exceptions, we have this big category. Access to services would be jeopardized. Good cause could be granted if access to services would be jeopardized, either because the provider is the sole source of specialized services in a community or serves a large number of people in a medically underserved area, which I present to you is the situation right now where there has been a severe disruption of services across our state. So that's all. I really appreciate you being here, and that's all I have to say.
Thank you, Senator O'Neill.
Yeah, thank you, Mr. Chairman. Thank you for the report.